Thank you for tuning in to this week's episode of Aging Gracefully, where we will be discussing skin rejuvenation, chiropractics, and sharing interesting advice to keep you feeling younger than you might actually be. All right here on Aging Gracefully on Suncoast FYI. Dr. Sessa returns this week to talk about the benefits of skin rejuvenation treatments. Thank you for coming back. We really enjoyed having you last week. So today we're going to talk about skin rejuvenation and what we can do more naturally to heal our skin.
Yeah. So, you know, we've all heard about omega-3s, how they're healthy for us. Well, they're really healthy for your skin. Omega-3s is one of the things that I really tell people. Of course, good quality water, lots of it. Sunscreen, of course, and we'll get to that in a little while. But two supplements that I really like that are very, very healthy for your skin. One is vitamin C, one is zinc. Especially if you get a cut or a bruise, vitamin C, zinc are very, very good in terms of collagen production. Your body needs those minerals to heal, to create more collagen.
Is there a certain amount of those that we should take every day?
Well, I don't know the recommended daily dose of it, but zinc for sure you want to take between 15 to 30 milligrams per day. Okay. And vitamin C anywhere from 250 to 500 milligrams per day. Okay.
And how about water? You mentioned water, quality water. What do you consider quality water?
Well, it's a good question. That's probably another discussion for another day.
Okay.
But, you know, quality water either you know, you have to be careful what you drink that comes out of the faucet.
Yes, I agree, because I don't like drinking water out of the faucet. So that was kind of a personal question there. But what kind of procedures are available for skin rejuvenation?
Yeah, so skin rejuvenation, that sort of puts the ribbon on the total package. So a lot of times when I do surgery, I will actually perform maybe a facelift, mini lift, or something called a smart lift, which is what I perform, which is a modified facelift, and then I laser the skin afterwards. All done at the same procedure, all one recovery, but the beautiful thing about it is when you remove the sunspots and you wipe off the upper layers of the skin, your skin grows back as smooth as a baby's, and it's as clear as a baby's. So think of your skin, if these are the layers of the skin here, right? Yep. Think of the laser or a nice chemical peel would take off the upper layer, right? So either chemically or with a laser, which is a controlled sunburn. So that when you remove that layer, it forces the other layer to grow more collagen. And that new collagen is new skin. And it comes back tighter, rejuvenated, clearer, better tone. So if you look at pictures, before and afters, that's where the wow factor is. When people say, wow, my God, look at that picture. Because it's not just, yeah, her neck looks great, the jowls, all the muscles, the face is balanced and proportioned, but the skin looks smooth, it looks clear. A lot of times you'll hear, why does your face look shiny? It's not that it looks shiny, but a smooth, polished surface always reflects more light than something that is mottled or different colors, so from sun damage. So, so that sort of covers a lot of different things.
Okay, so you use that in conjunction with the facelift, or they can be done independently?
Yeah, absolutely. So you could always do these procedures independently. Irrespective of what they're getting, but it works well when I combine it with other surgical procedures. Okay. Only because with a typical laser peel, this is more in tune of what's called medium depth. So medium depth is the upper layer of that skin, so even part of the another layer. Okay. And in doing that, you require about 4 to 5 days of where you have a very light scab on your face. But think of skin rejuvenation as a continuum. The lighter the peel, the less aggressive, the less downtime, but the less result you get. Okay? The deeper the peel, the deeper the stress to the skin, The better the result, the better the long-term result, but of course comes with a little bit of downtime, usually about 5 days.
Okay. Well, I would think if you're going to make that kind of investment in yourself,
Right.
that you have to take all of those things into consideration that go along with it.
Right.
Now, why is a laser peel better for long-term than other procedures
Sure.
that you may do?
So the thing I like about the laser is the heat is like an inverse plume, right? So if you think of like a hydrogen bomb, I'm very, I think of things in images.
Right.
If you think of like the way a hydrogen bomb sort of plumes up in the mushroom cloud, same kind of thing happens with your skin when the energy hits your skin. The plume is inverted though. So the heat goes down and then it spreads out. So in that heat, it causes the skin to contract. It also causes stimulation of collagen. So in that sense, the laser is always superior than a chemical peel because the peel has no heat generation. You will see the removal of the upper layers of the skin, so you will see the clearness to the skin.
Okay. Does it get rid of the dark spots?
Yes, it will take care of the dark spots, the sunspots, but it does very little for wrinkles.
Okay.
Only the laser will really help the wrinkles, especially around the eyes.
All right.
Yeah.
Okay. Well, for anything else that our viewers would like to know on this or other procedures that you perform, they can go to your website, which we're going to have posted on the screen, and we'll see you next week.
Okay, great.
All right.
Thanks.
Thanks, Doctor. Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break. Joining us in the studio today is Dr. Michael Hornberger from Hornberger Wellness and Chiropractic. He is here today to discuss the different benefits people of any age can gain from chiropractics. Thank you for being on the show today.
Hey, no problem.
We have so much we want to talk to you about. Let's start with, obviously, the obvious question, chiropractic. What is it? What is that all about?
Well, most people know a chiropractor to be all about neck pain, back pain, and headaches. And although it's very effective at treating those conditions, its roots are really based in health and wellness. Gray's Anatomy states that the nervous system is the master control system of the entire body. So my main focus is relieving stress on the nerves, so it promotes health and wellness.
Okay.
The spine is made up of 24 bones stacked on top of each other like this.
Yeah.
And at every level you have a pair of nerves that come out each side. The brain communicates through these nerves to every organ, tissue, and cell in the body. So all the vertebrae must move in sync just like this,
Right.
in order for everything to work correctly. Now sometimes
Yeah.
a spinal bone can misalign, or the joints aren't tracking correctly, and that creates an inflammatory process. And what happens is that inflammation can actually put pressure on a nerve.
Okay.
And when the pressure's on the nerve, the communication through that nerve is maybe 80% or
Right.
90%.
Right.
And in turn, that could affect your health overall.
And that's
greatly.
where the pain comes in. And these are the discs?
These are the discs. These are like a ligament in between
Okay.
all of the vertebrae.
What keeps you
that
flexible, right?
Keeps it flexible, exactly.
Okay.
And so what I do as a chiropractor is I find these areas of what I call subluxation. It's the term when the nerve is pinched, and I realign them gently and take the pressure off the nerve.
Okay. Now, obviously, if somebody's having back pain, they would come and see you for that. But who else should go see a chiropractor?
Well, I see people of all ages in my practice. I like to say I see people from womb to tomb, so all ages. And basically, if you have a spine, you should get it checked by a chiropractor.
So basic maintenance to keep everybody safe and healthy.
Exactly. And people get their teeth cleaned on a regular basis.
Yeah.
Why shouldn't you get your spine
Yeah.
checked?
And how
you see?
often would you recommend that?
Well, it just depends on what's going on with you. If you have an inflammatory situation, typically we'll see someone more often. Once we get the spine optimized, then we see people on more of a wellness or a maintenance basis to keep their spine healthy.
So you treat them after as well to keep them healthy
absolutely,
and happy.
yes.
Now, what, having a bad back, this is kind of a, a personal question, but how do you avoid having back pain or neck pain or headaches? I mean, and arthritis pains. I mean, is there any way that you can prevent that from happening?
And chiropractic is extremely effective in treating those conditions. However, the real secret is prevention, just like we were talking about. You come in, you get your spine checked on a regular basis. Even if you're not having symptoms, symptoms are the last stage to any disease process.
Sure.
So really what I focus on is wellness and prevention, and that's where a lot of my training is based in. So getting your spine checked, preventing the problem before it occurs is really the secret.
So doctor, can you tell us what's the first thing that you do when a patient comes to see you?
Yes, absolutely. So the first thing we do is we sit down with the patient and we have a talk. We have a conversation, and typically the first visit can take somewhere from 30 minutes to an hour. And we're going to talk all about their condition, and we're going to do orthopedic tests next, or neurological, or whatever the testing needs to be done. And that's when I evaluate and see what the problem actually is.
Okay, so you do that same day, or you
Yes,
bring them? Okay.
Yep, so we'll do it that
That's
same
great.
day. And then if necessary, we do x-rays in the office. We have a digital x-ray system, so we could pull them up in a second, and we
Okay.
could see what's going on with the spine. And I ask most of my patients to give me a day to come back so I could read them and evaluate, put everything together for them. And then when they come back, I go through their results.
Okay.
And we
So-
discuss how we're going to.
So once somebody comes to see you, you determine a course of treatment. How long does that course of treatment take? What does that depend on?
Well, that really depends on what the patient's goal is. In my office, I offer 3 different phases of care. And the first phase is the relief phase, where my main goal is to get you out of pain as quick as
Sure.
possible. And that could take 1 treatment, that could take 10 treatments. It really just depends on the individual and what's going on with them.
Okay. Well, and again, you keep following up. You don't let them leave you until you feel that they're ready to go and
Exactly.
feeling better and out of pain.
And exactly, and that leads me into the second phase of care. Once they're out of the pain, many people choose to keep coming because they want to optimize their spine and the biomechanics.
Right.
And this is when people get their range of motion, they're more mobile, they can do things
And
that they
they're
haven't
feeling
done
better. Yeah.
in 10 years.
Great.
So-
Well, we're going to talk about that when you come back and join us next time.
Sure, absolutely.
So for now, though, please share with our viewers your website so that they can go and find out more about you.
Sure, it's hornbergerwellness.com, and you can check out all the information you need to on the website there. Yep.
Well, thanks for being with us, Doctor.
No problem.
Appreciate
Thanks
it.
for having me.
Please stay tuned. Aging Gracefully on Suncoast FYI will return after a short break. Dr. Sampson returns today to discuss peripheral arterial disease, or PAD. Thank you for coming back today. It's nice to see you.
Thank you.
Could you tell us what PAD is?
So it stands for peripheral arterial disease. So as everybody knows, the body has arteries and veins, and we've discussed veins before. But it's the arteries that really are so much important to your body because they take blood out to supply the tissues. And if you have a problem in the arteries, then your tissues can die. So peripheral arterial disease is where you get a blockage in the artery that supplies mainly the legs, sometimes the arms, but it's mainly the legs. That's why it's called periphery, away from the heart.
Okay.
But it's the same disease process that affects the heart. So someone who has a heart attack, they've got arterial disease of the heart. Someone's got peripheral arterial disease, they've got arterial blockages in the arteries to the legs.
And how is this diagnosed, doctor?
Well, the majority of people have it without even knowing that they have it. But sometimes the doctor will do a pulse examination on your legs and find that your pulse is not good, or you'll complain of a symptom of peripheral arterial disease, which is mainly trouble with walking. So the person they go for a walk, they start to get discomfort in the leg, they stop walking, the pain goes away. And that's because when they're walking and they don't have enough blood supply, acid builds up in the leg, and that causes pain. And when they stop walking, the acid washes out, the pain goes away. There is a medical term for this. It's called claudication, but you're not supposed to know that.
Okay, you're not supposed to know that, or it doesn't, I mean...
Well, we know about it, but you don't have to.
Right.
Right.
So if, for example, I mean, the average person, they're walking, this happens, is there a numbness, or is there a tingling, is it just a pain? I mean, what is the most common?
As the blockage gets worse, there are going to be more and more symptoms. So usually the walking distance gets shorter and shorter. And then you get pain even at night while you're sleeping, because when you're lying flat, you don't have gravity to help the circulation. So those people say they have to get out of bed to let their feet dangle over the edge of the bed to get rid of the pain. And then as things progress, they can actually get an ulcer of the skin where they get a wound, or even gangrene.
Oh my goodness.
So we as doctors, we do have tests that we can do, and one of the simplest tests is to use a thing called a Doppler. It's like a special little stethoscope that we put on the artery, and we can hear the blood flowing, and based on that we can tell whether you have circulation trouble or not.
Okay. And what is the common treatments for PAD?
Well, the majority of people don't need any treatment per se for the blockages. They can live with the blockage. Treatment would be a quality of life decision. So most people can get around adequately. They don't need any treatment. Certainly they need medication to prevent the blockages. So as I've said, this is the same blockage that causes heart attack, same blockage that causes stroke. So a lot of people are put on drugs called statins that change cholesterol, because that's one of the causes of blockages. Some people take aspirin. Some people take a drug called Plavix. People need those medications, but do they really need some invasive treatment for their leg? That really depends on their quality of life. So we tell the patient, if I had a treatment that was painless, cost nothing, and was guaranteed to work, they would have it. We don't have such a treatment. So our job as the vascular surgeon is to explain to the patient what the different treatment options are, and then let them make a decision.
Okay, and that's it. I mean, everybody should be informed, and unfortunately, like you've stated in the past, people aren't given all the information that they need.
I think one of the reasons that I'm here again, as I was the last time, is to tell people that they shouldn't be forced into having treatment. This is a quality of life decision. So if the doctor says to you, you're going to lose your leg unless you have this treatment, that may actually be true if you've got gangrene, or if you've got a sore that's not healing. But if your only trouble is walking, you're not going to lose your leg unless something terrible happens. So be an educated consumer of information. Know what you're in for.
Okay. Now, are all doctors able to diagnose and treat?
Most doctors
PAD?
can diagnose and treat PAD, but there are various treatments. They can be a balloon procedure, or a stent, or it can even be a bypass operation. So the only group of doctors that can do all of that are obviously surgeons. So vascular surgeons can give medications, they can treat with balloons and stents, and they can do surgery. But there are other doctors like cardiologists, interventional radiologists that can do balloons and stents. But not everybody should have a balloon or a stent. So we kind of feel you should go to somebody that can offer you all the different treatments.
Okay, now when you say quality of life, so if somebody decides that they don't want to have anything done at all, is it a gradual thing that will just over time?
The majority of people don't get worse.
Okay.
So we tell them to exercise, because the more you exercise, the more you build up what we call collateral arteries that will kind of go around the blockage.
Right.
And patients can often do very well just in an exercise program.
And it will increase your blood circulation, your blood flow.
Correct.
Okay. Well, again, thank you for all the
Our
information.
pleasure.
I really appreciate it.
Thank you.
Thank you. Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snnTV.com under programming. See you next Saturday and Sunday at noon.